Your eyes and your vision are under attack, damaging blue light from the sun. Your phone, your computer, your tablet, even light bulbs and car headlights is constantly bombarding you. The good news is our eyes actually already have a line of defense to counter the effects of blue light. This defense is made up of 3 pigments called carotenoids. MacuHealth with Micromicelle, the only supplement with the exclusive patent on all 3 macular carotenoids and Micromicelle technology.
Do your patients know what presbyopia is?
There are people who are afraid of the press.
Have you talked to your patients about multifocal contact lenses?
I've heard the bifocal, but not multifocal.
Not multifocal.
Do you need help with your multifocal strategy? Learn more at the conclusion of this episode. With more screen usage and indoor time, myopia, also known as nearsightedness, is increasing and getting worse in children. Now, certified eye doctors can prescribe MiSight One Day, the first and only FDA-approved soft contact lens to slow myopia progression in age-appropriate children. Visit CooperVision.com to find a Brilliant Futures certified eye doctor near you. Good morning, I'm Dr. Kerry Gelb, and welcome to Wellness 1280 on Open Your Eyes Radio. Please listen as I discuss the newest information in the world of health, nutrition, and sports every Saturday morning, 6 a.m. Central Time on AM 1280, The Patriot. Also, please share your thoughts by emailing me at drkerrygelb@gmail.com. That's drkerrygelb@gmail.com. And visit my new website, wellness1280.com, where we have all guest links, Wellness 1280 info, and previous shows. Wellness is taking over the Patriot Airways for the next hour. So sit back and enjoy my conversation with Dr. Heather Sandison. In 2024, an estimated 6.9 million Americans aged 65 and older are living with Alzheimer's disease, the most common form of dementia. And the number is expected to triple by 2060. Conventional medicine has no cure and provides little hope. And at best, medication could only slightly slow the progression. Today's guest, California naturopathic physician, Dr. Heather Sandison. Dr. Sandison's research, along with other researchers, have shown cognitive decline can be improved using a multimodal approach, which includes diet, lifestyle, supplements, and many other factors. Dr. Sandison's groundbreaking book, now on the New York Times best-selling list, Reversing Alzheimer's, gives the reader a simple and easy roadmap to preventing and reversing dementia, improving memory and cognition. Dr. Sandison is also the founder of Solcere Health Clinic and Marama, the first residential care facility for the elderly of its kind. Dr. Heather Sandison, thank you for joining me today on Wellness 1280, Open Your Eyes Radio with Dr. Kerry Gelb.
It's a pleasure to be here. Thank you for having me.
Thank you, Dr. Sandison. I'm very interested in your work. I'm very interested in the work of Dr. Bredesen. You know, as an optometrist, I see a lot of patients that are getting Alzheimer's disease. We use technology called OCT, which can sometimes pick up non-specific signs of Alzheimer's. We'll see thinning of the macula on the OCT. It's called ocular coherent tomography, and it uses waves, light waves, to be able to slice the retina into different sections. And we could start to see thinning of the choroidal vessels, which are the little blood vessels inside the choroid of the eye, which shows that vessels are dropping out. If they're starting to drop out in the eye, they could most likely, because the eye and the brain are similar, they could be dropping out in the brain. And the nerves, because it's a combination of a nerve disease, a vascular disease, and we're going to talk about the different causes, possible causes of dementia. And we could see it in the eye very early. But I want to ask you, is it true that we can now start to stop or even possibly reverse dementia or Alzheimer's?
You know, I know it's a bold statement. My book is called Reversing Alzheimer's. And I talked to the publisher when we were discussing the title, and it was like, can we do this? Can we say this? And the reason I feel so confident is because I've seen it happen in my patients and my coaching clients and in our residents at Marama over and over and over again. It doesn't just happen occasionally, it happens regularly. And to your point, early detection using the eyes, the nose, ears, right? Our sense organs are this extension of our central nervous system, or an extension of our brain. And when we can detect this disease process early on, we have much more confidence that we can get a reversal of the disease process, of the pathophysiological process leading to neurodegeneration. If we wait until the end stage, although we've seen miracles happen many times, it's definitely not guaranteed. There's a ton of suffering that happens along that path leading towards significant dementia. That why not? Why not get started earlier? I think most people have heard the refrain over and over again. There's nothing you can do for Alzheimer's or dementia. They might have even heard this from a well-meaning neurologist. But we know now through Dr. Bredeson's work and much of the research that's being done on lifestyle interventions that there is almost an overwhelming amount that we can do to support neurocognitive function as we age. And so I love this idea of sort of combining this early detection that we can get through looking into the eyes, through there are smell tests that are being proposed to use as an inexpensive way to pick up early Alzheimer's. And then we also know that the ears, one of the modifiable risk factors when it comes to dementia is supporting hearing. If you're going through hearing loss, if you're experiencing hearing loss, getting hearing aids and treating that reduces your risk of developing dementia over time.
You know, you've done a groundbreaking study which shows that we could reverse dementia or slow it down by close to 75%. Dr. Bredesen in the 80s, 84%. Could you review those two studies with me?
Yes, and absolutely. I'm also going to add one more that came out in June of 2024. So in 2022, Dr. Bredesen and his team, led by Kat Toops, they published a clinical trial that it included 25 participants who they took through a 9-month intervention. This was an aggressive intervention, right? 9 months, they threw everything at it: diet, lifestyle. They did all of the functional medicine precision-based testing, looking for toxins, infections, nutrient imbalances, gut issues, you name it. They looked and they corrected it wherever they could. And what they saw, they took patients who had MoCA scores down to 19. So the MoCA is the Montreal Cognitive Assessment, and it's a simple tool that's free. The PDF is available online. It's easy to administer. A tech can do it. You don't need a doctor or nurse to do it.
And it's like it's a memory test.
It's a memory test. Many people will have heard of this, right? There are presidents who refer to it and say they got perfect scores. And what you do is you identify zoo animals, you draw a clock, copy a cube, identify where you are in time and space, and it's out of 30. So perfect score is 30, normal is 26 and above. They took participants who have had cognitive impairment with MoCA scores down to 19. So again, 25 participants, 9-month intervention, Dr. Bredeson's approach, with MoCA scores down to 19, and 84% of participants improved their cognitive function. So for most people with declining cognition, what we expect is a 3-point drop in the MoCA score per year, per 12 months. That's 2 to 3 points is average decline. What they saw was an improvement. So it went in the other direction in just 9 months. A year later, I was able to publish, we were doing these studies at the same time on parallel tracks. I actually didn't know Dr. Bredesen when I got funding for my trial and when we got IRB approved and we were able to get started. And so I didn't have a dialogue with him around it, but I happened to essentially design a very, very similar trial based on my clinical experience, putting his information and his training to work in my office. So we took 23 participants through a 6-month intervention, and we took participants with MoCA scores between 12 and 23. So again, they took participants with MoCA scores down to 19. As you get closer to 0, that's worsening cognitive impairment. And normal is 26 and above, perfect is 30. So our participants have MoCA scores of 12 to 23, so more advanced dementia. And we included participants who had diagnoses of Alzheimer's. And what we saw there was with a shorter intervention, just 6 months, we saw that 74% of them improved. And we had statistically significant increases in the mean cognitive scores, both on Cambridge Brain Sciences and the MoCA testing across all of our participants, and also statistically significant improvements in quality of life and sleep.
And so what did they see exactly? Was memory getting a lot better? Was it getting a little bit better? What were we seeing? Was it, learning? Was learning easier? Could they do simple tasks better?
Precisely, all of the above. So we saw statistically significant improvements in overall composite cognition, memory specifically, but also improvements in verbal ability, reasoning, focus, and other cognitive tests that we did. Across the board, we saw improvements. Not all were statistically significant, but across the board, we saw improvements in quality of life and their ability to take on day-to-day tasks. Now, there's a third study that just came out in June of 2023. It was done by Dr. Dean Ornish, and this was a lifestyle intervention, and it was just 5 months, but it was a randomized controlled trial. So they compared one intervention group to a control group, and what they saw was, again, when we apply these lifestyle interventions to people who already have mild cognitive impairment or early dementia due to Alzheimer's disease, we see improvements in their cognitive function.
And you have done some great work to help people in memory care and extended memory care. Can you talk a little bit about your facility and how we could ask people around the country to join in and look at Dr. Bredeson's work and your work to help people who need memory care?
Yeah, so our goal is to turn memory care into memory recovery and help people who are in independent living or maybe even assisted living who kind of are looking at that potential of going into memory care, that there might be an alternative. There might be another way to do this. And what we've done at Marama is created an immersive experience in Dr. Bredeson's approach. And our goal is to get more people access to this by partnering with people who already own and operate existing senior living facilities across the country. No one wants to go into memory care. No one wants to go into assisted living, right? If you ask someone, usually people who are in their 40s, 50s, 60s, they say, take me out in the back and shoot me, right? Before you put me in a home like that, I would rather do anything else. I don't want to have to pay for it. I don't want to be a burden on my family. I don't want other people to I don't want to lose my dignity in that way. And so an opportunity to go a different direction and go towards memory recovery is so exciting. And what we've seen is that we can get those outcomes, particularly when people move in before they actually need full memory care. But it is really on these foundations of 4 pillars at Marama that we employ there. And this is, again, this immersive experience in Dr. Bredeson's approach, where we have an organic ketogenic diet, so very low in processed foods, almost no processed foods, and very low in carbohydrates, so that we start burning fat for fuel in the brain. This allows the brain to get more energy, more resource, so that we can do those creative tasks, execute those plans that we have, and reason and remember the names of our loved ones. So organic ketogenic diet is one.
Tell me what's on the ketogenic diet? What does that involve? Does that mean people have to eat fat all day long, or are they eating coconut oil all day long? What does it involve?
Yeah, there was a recent trial that told us that having MCT or medium chain triglycerides or the coconut oil that MCT is found in can improve cognitive function just using 1 to 2 tablespoons a day. So it's something that even without getting into ketosis and reducing your carbohydrates, you can get started by just taking 1 or 2 tablespoons of coconut oil each day. And that can help in multiple ways, but primarily by sending those medium chain triglycerides into the system, which become beta hydroxybutyrate, or the form of ketones that our brain likes to burn as fuel. So again, we can use that instead of carbohydrates, sugar, glucose, those can be used interchangeably and burned as fuel. As we age, all of us end up with some sort of insulin resistance and difficulty turning glucose into ATP, or that fuel our cells run on. But our bodies and our brains are just so divinely designed and incredible to me. We are like hybrid engines. We can just flip the switch. And if we restrict carbohydrates enough, we can start burning ketones for fuel. This creates less oxidative stress. It's actually detoxifying. It reduces inflammation. And we're more efficient at burning it and turning it into ATP. So we actually have more resource available. And so we see that in patients, they'll go from not remembering their grandchildren's names to 3-4 days later, knowing all of their names and birthdays. I mean, it's just miraculous. It's pretty amazing.
What should people cook with? What kind of oil?
So coconut oil, avocado oil on higher heat, olive oil, the high polyphenol olive oil, if you are like putting on salad dressings and things like that. Butter and ghee are also okay on higher heat. And those are my favorites.
And so what kind of foods should people be eating on the diet? Is fish okay? I mean, because fish has a lot of mercury in it, and mercury can increase your risk of memory loss. So
Mercury.
how do we navigate the fish part organic turkey and chicken, grass-fed, pasture-raised, meats, everything, one ingredient, vegetables, stay away from sugars. But explain to me about the fish part, because I know that's on the ketogenic diet, but how do we navigate with the mercury?
Yeah, great point. Mercury is highly neurotoxic. We want to make sure we're not consuming that through fish. And the way to do that is to focus on the smash fish. So wild caught salmon, mackerel, herring, sardines, and anchovies. I might have gotten the acronym there mixed up, but you get the point. The SMASH is the acronym, and those are the fish that will work. You want to get cold water fish that are high in omegas. If you can stomach anchovies and sardines, those are amazing for you. If you don't like the flavor, then that wild caught salmon is a great idea. Farm salmon tends to be injected with antibiotics. They're fed corn, not in their natural habitat, not their natural diet. And not only are they not good for you, they actually can be bad for you. So I would recommend avoiding all farm salmon, and then avoid tuna, shark, swordfish. These are all going to be particularly high in mercury. And then a standard day on a ketogenic diet might look like an egg breakfast. So skip the toast, but have a few eggs with some avocado or some salsa. You can mix this up. And I like to think of like going around the world. So you can have eggs every morning for breakfast, but you might have an Asian style egg one day. You might have Italian, like some tomato and basil on your eggs the next day. And then the next day it might be more Mexican inspired, right? And it'll be cilantro and a salsa. And so you can have the foundation of your diet be the same and get those great macronutrients, the fat and the protein in, but change up the flavor, because spices can be used as medicine as well. And then also, I'm someone who likes to eat different food every day. I really like the variety. So eggs are a great keto breakfast, but we also have keto oatmeal. Some people are allergic to eggs or they don't tolerate eggs. There are lots and lots of different options. And then
interrupt you for one second about eggs. People a lot of times will eat an egg white omelet. They think it's healthy. Should they eat the yolk or not?
so choline is in eggs, and in egg yolk in particular, and choline is really crucially important. This is acetylcholine, is one of the most abundant neurotransmitters in the brain. One of the common medications for Alzheimer's or early dementia is donepezil or Aricept. This is an acetylcholinesterase inhibitor. It's actually, the goal with that is to increase the amount of acetylcholine in the brain. Eggs are a great source of choline. And so I recommend eat the whole egg. If you're worried about cholesterol, getting on a ketogenic diet is a great way to reduce your triglycerides, and you actually start burning fat for fuel. In the first few months, you can see your cholesterol go up. So don't let your cardiologist be totally alarmed. Take a minute, stay in ketosis for about 6 months, make sure you're having plenty of fiber, and you will see a lot of those most risky cardiovascular numbers resolve, particularly if you get the carbohydrates out. When we have high fat and high sugar together, this is like the milkshake diet, which leads to a heart attack. It leads to vascular spasm, inflammation. This is really bad for us. But if we're having non-processed foods that are high in those good fats that we talked about, butter, ghee, grass-fed butter, ghee, olive oil, avocado oil, the coconut oil, of course, these are really good for us and actually help to bring down our inflammatory levels and optimize our cardiovascular markers.
How long when people start these type of programs, and we're going to talk about the exercise, the stress, all the other things that are needed before you start seeing some improvement in patients?
Yeah, so, I have been surprised. I came to Dr. Bredesen's work. I was trained by him and I was a total skeptic. I did not think that I could help people get better because I had been told over and over again by my instructors, people who I had a ton of respect for, that it wasn't possible. And now we see sometimes in a month, people are coming back and I see them already doing better. They're not 100% better. They're not necessarily going back to work or back to, all of their activities of daily living, but there's improvements. And then after 6 months, 12 months, we're seeing actually more and more and more improvement. I remember reaching out to Dr. Bredesen about 2 years into our experiment, essentially at Marama. We opened in 2020. And about 2 years later, we had this woman who'd been there for the whole time. And I was like, she's still getting better. How is she still getting better? I thought she would get a little bit better and then plateau. And Dr. Bredesen was like, of course, it's synergistic. Once her neurons are better, now she has synaptogenesis and it starts building. It continues to build. And if she's in the right environment, getting the right nutrients, getting the right engagement, of course, she'll continue to get better. So we're really at the early stages. Dr. Bredesen published a paper showing that people who started this 10 years ago still have maintained and sustained their optimal cognitive function. So we know know that when you put this to work, it can work for a long time. The issue is when you fall off the wagon. When you stop doing it, it stops working.
People lose gray matter when they're getting dementia, about 4% per year, a little bit over. I guess the average person loses maybe 1.5% per year. But in some of the studies, it showed that gray matter actually improved. They actually showed improvement in gray matter.
It's true. Yeah. And Dr. Bredesen's paper that was published in 2022, they saw improvements on imaging.
I mean, that's amazing. Again, I mean, that should be on the front page of every newspaper.
And when you compare it to the images of people who are on these monoclonal antibody therapies, their brains look like they age 100 years in 6 weeks. It is wild. Like if you were just to show patients, this is your, like the whole, this is your brain on drugs. If you were to show people before and after pictures of the brains of people who do Dr. Bredesen's, his protocol versus those who do the monoclonal antibody therapies, no one would have a question about what was better for the brain.
Yeah, I've interviewed Dr. Bredesen, and you could find him on my Open Your Eyes podcast, and that was a great interview. And we just replayed it not too long ago. And Dr. Bredesen, he just wants people to get better and help people that have this horrible disease. I mean, I never met somebody who just loves people and wants to help people the way he does. I want to ask you, you mentioned spices. Are there any specific spices that people should have?
Yeah, so curcumin is well known to reduce inflammation. Much of Alzheimer's is associated with inflammation. And so adding some curcumin with black pepper and with fat, typically that helps to have it be absorbed readily. It also helps support BDNF, brain-derived neurotrophic factors. So whenever you get an opportunity to add more turmeric or curcumin onto something, I'm a yes. Rosemary is also a Western herb that's associated with memory and cognitive function. It's also antimicrobial. And we know that microbes, particularly herpes simplex virus 1, P. gingivalis, which is associated with gingivitis, Lyme spirochetes, as well as COVIDs potentially can all increase our risk for developing Alzheimer's and dementia. And so having spices on board, these Mediterranean spices like oregano, lavender, rosemary, all help to reduce our risk of those microbes getting out of control and help with that healthy brain-gut connection by enhancing a healthy gut microbiome.
I'm speaking with Dr. Heather Sandison. We're talking about dementia and how we can help people that are starting to get dementia. You just don't wake up with dementia. It takes about 20 years for it to happen. We'll be back after the break.
MacuHealth, your science-born and tested solutions for visual performance, macular degeneration, and dry eye syndrome. New products coming soon. Embrace the science.
We're back. This is Dr. Kerry Gell for Open Your Eyes Radio, and we're back with Dr. Heather Sandison. Dr. Sandison, her goal is to help people that are starting to get dementia, helping to reverse it. She showed studies that it can be reversed, and she's teaching us what we could do to help us reverse it. Pick up her book, Reversing Alzheimer's, now on the New York Times best-selling list. Congratulations, Heather, on that. That's great news.
Thank you so much.
So we're back. We were talking about the pillars that you use. We did pillar 1. Let's go to pillar number 2.
Yeah, so pillar 1 is that organic ketogenic diet. Pillar 2 is exercise and brain engagement. These are the activities that we do every day. So at Marama, what we encourage and what we have enough staff for is to keep someone's loved one, right? Or if you're sending your mom off to memory care, you want her to be engaged, not stuck in front of a TV all day, checked out or isolated in her room, but actually engaged in creative activities that she's fired up about, or gardening, or engaging with animals or other people, puzzles, and then of course, exercise. We know that the brain needs exercise, both strength training and vigorous physical aerobic exercise. And we recommend about 200 minutes a week. You'll see recommendations between 150 to 300, but we kind of say 200 minutes, 4 days a week, getting about an hour each of those days of exercise, but some combination of aerobic and strength training. Now, there's a third type of exercise that I want to throw in.
Where's Marama located, by the way?
So we have a location in San Diego and then another location in Wichita, Kansas. And we're looking to expand across the country because no one wants to send mom to San Diego if you live in New York. And we have lots of people who have done that, who have moved from Florida and from New York and from Hawaii and from all over the country to be at these locations because we're the only ones doing this. But our goal is to start partnering with existing senior living facilities so that we can start getting access to people closer to the homes so they can keep going to their own church and seeing their families and their grandkids. That's really what that phase of life is about, is still being engaged and active in your community. And so we want to bring Dr. Bredeson's work to the place where people need it most, which is these assisted living or senior living facilities where you can be in community, still contributing to your family and the people you love most. And so we have
What's a special type of exercise you were about to tell us?
Yeah. So this is dual task. Dual as in DUAL, two things at the same time. Cognitive engagement at the same time as physical engagement. This might be as simple as going for a walk and talking to someone that you love about something engaging, or it might be going to a class where you're cued by an instructor, a Pilates class or a Zumba class or a jazzercise class, where you've got to keep up with where's my right foot going while my left arm is doing what. That keeps us cognitively engaged. And what we see is we get even more benefit for every minute we spend exercising if there's cognitive engagement happening at the same time. So if you aren't already doing that, it's a good idea to put that into your weekly exercise routine. So again, the pillars: 1, organic ketogenic diet. Number 2 is engaging exercises and activities. You want to lean into the things you love, because we don't want this to be something you just do next week. We want it to be something that you want to do for the rest of your life, whether it's writing an autobiography or if it's creating puzzles or creating some sort of birdhouse, right? There's so many things that you can do that are creative and engaging. Cooking is a great example. There are learning a new language, music. There are lots of ways to engage the brain, but I encourage people to focus on the things that you enjoy so that they become part of your routine, part of your habit, part of your identity. So organic ketogenic diet, brain engaging activities and exercise, and then the environment. So environment, this applies to cognition in a few different ways. 1, we want a non-toxic environment. So get rid of the nonstick, make sure your water isn't full of lead and mercury and all kinds of stuff that's going to be toxic to your brain. Make sure there's not mold or water damage in your house. Make sure that your cleaning products are non-toxic and they aren't contributing to neurotoxicity in the brain. And then also, we can think about our environment as something that impacts our behavior. So is our living room set up so that when we walk in the door, we just automatically turn on the TV, kick our feet up and check out? Or are there books? Is there a comfortable place to have a dialogue with someone you enjoy? Are there fun puzzles? What is there to do that's set up that's easy to do? Is it easy for you to go outside quickly? Or is it uncomfortable outside? Are you likely to get a sunburn? Is it too hot out there? Is it not secure and safe? Is it easy for you to trip? Is your environment set up? And what behaviors does it encourage? Is there a bunch of cookies and cakes on the kitchen counter so that whenever you walk into the kitchen, it's easy to mindlessly pick some of that up and eat it? Or do you have healthy ketogenic fruits and veggies and things that are going to be brain healthy foods that are easy and accessible? We can also think about clutter. Clutter tends to add to that underlying level of stress and anxiety. And especially when we've, raised kids in a home and we've been there for 30 years, maybe 50 years, we've been there for a long time, stuff accumulates. And so to being mindful about what our surroundings, what our environment looks and feels like, and how that changes our behavior and our mood is just part of the invitation, and something that we take very seriously at Marama and at our senior living locations. We make sure that it's sort of a Zen-like environment that really enhances that ability to connect socially with our peers.
I want to ask you about water. How in these facilities are they filtering the water to make sure that these older people are getting clean water that's not toxic?
Yeah, so we have Mountain Valley spring water trucked in glass for the most part. Now, if that isn't accessible, it's not delivered everywhere all over the country, although it's delivered in a lot of places through distributors. You can also go to findaspring.com, and sometimes they will have good spring water that's not contaminated that's available. And you want to make sure that you bottle it in glass because plastic will leach into the water. Another alternative is reverse osmosis water. And so that's a way to filter the water. However, it does take all of the minerals out. So you want to make sure that you're replacing minerals so it doesn't leach out of your bones. And with RO water, depending on where you are in the country, and what filter you get, you're gonna waste, for every gallon of reverse osmosis water you create, you're gonna waste 2 to 4 gallons. And so if you're in the desert, it sometimes doesn't make as much sense and the cost goes up pretty quickly.
And what minerals do people that are starting to get dementia, what kind of minerals do they need? Are they usually deficient in?
Yeah, so we recommend using sea salt as a great mineral replacement because it's naturally occurring. It's in the ratios that you mostly need it. Outside of that, I would test. I would test with your provider because deficiencies in zinc or zinc and copper ratios that start to get off too high copper with lower zinc, that can affect your immune system, your mood, and your cognition. Magnesium is another common deficiency, as is potassium and manganese. So we want to look at those ratios and understand what's there. But if you're guessing, if you haven't had those tests done, then you can go ahead and use sea salt as a mineral replacement. And I recommend about a 1/4 teaspoon per gallon of water.
Do we have to worry about sea salt because the water is contaminated?
The
Just,
microplastics.
yeah, just like the fish that we were talking about before.
It's so hard. I tend to get the real salt from Utah, and I don't know if there's a way to completely eliminate all of the toxic exposure. We live in a toxic world, and instead of getting, too wrapped up in the things that we don't have control over, I try to focus on making sure, are you having a bowel movement every day? Are you drinking plenty of clean filtered water? It's as clean as you can get it or find it, you have access to. Are you sweating regularly so that you can get those toxins out? Are you supporting your liver with good foods like beets and artichokes? And you can take supplements that help to replenish those nutrients that the liver needs. And then breath work, exhaling is another way that we get rid of toxins. This is why a breathalyzer works for people who have been drinking. So having a daily breath work practice can be another helpful way to eliminate toxicity.
How about Himalayan salt?
Yeah, so Himalayan salt, Celtic sea salt, Hawaiian salt, real salt from Utah. There are lots of these different naturally occurring salts, and those are the ones that I recommend. And I think you can use them interchangeably and you can spend as much as you want. There are very fancy salts out there and there are more affordable ones.
Okay, you can keep going on number 4, I think we're up to.
Our last pillar is the caregiving. So on the Bredesen protocol, there's a lot of supplements and sometimes medications, hormone replacement or detox support. And these take a lot. It can feel like a full-time job to manage the prescription refills. And am I getting it at the right time or with food or without food? This can start to feel like a lot. And so our staff is really well trained to make sure that you are getting those supplements and medications exactly the way that your doctor wants you to, exactly the way they intend every single time. The other really crucial component to how we train our caregivers is that their expectation is that our residents will improve. And we interact differently with people when we expect them to get better versus when we expect them to be getting worse. And so that is just a huge part of why our program works, why we've seen that in our Kansas, our newest facility in Kansas, of the 6 people who have been there more than 6 months, 5 of them have cognitively improved measurably.
Well, that's terrific. Now, there's 11 million people that are unpaid caregivers in the country, and those people are also at risk of getting dementia, like a 3 to 4 times greater risk. Why do you think that is?
Yeah, so the literature is actually anywhere from 2.5 to 6 times more likely to be diagnosed with Alzheimer's or dementia later in their life compared to those who never serve as caregivers. And the male spouses of a female partner with dementia are at the highest risk. And I think that this is because of the stress. Cortisol becomes toxic to the hippocampus, the memory center of the brain, when it's up too high for too long. And caregivers, they're under an extreme amount of burden, right? Financial burden. It's very expensive to care for someone with dementia. It's also very exhausting, right? It's physically exhausting and it's emotionally bankrupting, right? And there's this, sometimes dementia sufferers, they're compared to children because they become dependent on us. But I have a 5-year-old. I know that every year she's getting more and more independent. I know what to expect for her milestones and what's going to happen next. And as long as she's healthy, she's on her trajectory to be living on her own at 18 or 19, right? When you have a spouse or a parent with dementia, a loved one with dementia, you don't know if this is going to last a year, 3 years, 5 years, 10 years. There's so much that is so unpredictable, and you don't know what they're going to lose next. And there's this grief that comes with that each day when you lose a little piece of that loved one.
You know, I've had many patients that have taken care of, they were caretakers for their husband, or, you know, the husband taking care of their wife, and they seem so miserable, the caregiver. But when the patient dies, they get even more miserable. They're so unhappy.
There are so many complex and intense emotions that come up for caregivers of someone with Alzheimer's. And imagine the intensity of the emotions coming up for the person who is experiencing Alzheimer's. I mean, we often hear this caregiver perspective, and I think it's such an important one because caregivers are often like they're kind of on the sidelines. The patient, the doctors are usually focused on the Alzheimer's patient, right? And nobody's turning to the caregiver to ask, "How are you? How are you doing?" And I think part of that conversation, one, it's dynamic, it's constantly changing. And for caregivers, there's this feeling of love, of course, and compassion for the person that they're caring for, and also the burden and the guilt and so much else that comes with it. But growing old together is a privilege that's denied to many. So I think there's also a ton of gratitude. And there is this opportunity to expand and to amplify the connection and the love, and to basically be trying to connect rather than correct our loved one with dementia. Whenever we have the opportunity to lean in, to apologize sometimes, even if it's not our fault, right? When we have the opportunity to make eye contact, to feel the feels together, to get vulnerable together and to connect, there's this sense that caregiving can become one of the most satisfying parts of our lives. And it's finite, right? It doesn't last forever. Sometimes it lasts longer than we expect or longer than we want. But there is this opportunity as someone is suffering with dementia to be grateful for the time that we do get with them, for the memories that we do make, that their grandchildren and great-grandchildren actually get to meet them, right? Because the alternative is that they're not there at all. Now, the other component of this is what happens after. And I see many caregivers, because they are so dedicated to their loved one, they kind of give up their own life and just focus on taking care of the person suffering with dementia. And I think that that is actually does everyone a disservice. So instead of becoming a martyr, we recommend, this is the first thing I tell caregivers, if you do nothing else, I want you to have an 8-hour block every week that is dedicated only to you and caring for you. You are not allowed to go take care of grandkids. You're not allowed to go take care of your daughter. You must use that time to take care of you. And this does two things. One, it forces them to create a backup plan for if they're unavailable to their loved one. And two, it forces them to maintain their own identity so that when the caregiving phase of life is over, they're not left with nothing.
You know, in Lancet, they have the risk factors for Alzheimer's or dementia. Can you go through the risk factors so the people listening at home, Dr. Sandison is kind enough, she's going to stay for another part, and we're going to have part two next week. But if you could go through some of those risk factors, because these are common things that everyday people have, but it's something that not only will help your eyes and your heart, but it helps your brain. It's just part of functional medicine. You know, functional medicine, Dr. Bredesen talks about 36 holes in the roof, and I think he added a couple more, maybe he has 38 holes in the roof, and you could plug a couple of the holes, but still, if you have the other holes, the rain is still going to come into the house. So you really need a holistic approach to be able to fix all these things. And we talked a lot about diet and things at the beginning, but talk about the risk factors that were in Lancet to increase your risk of getting dementia.
Yeah, and just to set the context for this a little bit more, so the Lancet is a very, very reputable journal out of the UK, and they basically take information and data and research from all over the world, and then they combined it, they analyzed it to create this commission report on dementia and Alzheimer's, which came out originally in 2017 and then was updated in 2020. And they have added risk factors to this list over the years, and they essentially suggest that 40% of worldwide dementias could be preventable. Now, I think that that number is much, much higher, that if we were assessing all of these factors and putting it into the conceptual framework that Dr. Bredesen and I use, that we would be able to prevent at least double that. And so, just to set the stage that this is conventional, this is very reputable, this is not some wild granola, out there functional medicine thing that isn't well accepted. It is, and it's common sense. It's just not talked about often enough. So many people don't know that this list exists. So what is on it? High blood pressure. This is a modifiable risk factor when it comes to dementia. In fact, in this Lancet Commission report, there's this amusing perspective that they have. The only known medication to prevent dementia is antihypertensives. So none of the medications for dementia prevent it from progressing. The only known medication to prevent dementia are the ones that control your blood pressure. Smoking.
Just interrupt you for a second. But some of the blood pressure medicines also increase the risk of having memory loss, such as the ACE inhibitors and the ARBs, because they interfere with norepinephrine and epinephrine.
And beta blockers.
And beta blockers as well. Yeah. Could decrease your memory. So how do you square that with having control of your blood pressure? And that brings us back to lifestyle and diet, and to try to do it in a more natural way, possibly. But talk about that. I know that's a difficult problem for a physician when you see patients. So that's something that you have to think about.
Yeah. So of course, we start by lowering blood pressure through diet and exercise, and stress management as well. Breath work, meditation, prayer practices, managing our stressors has a huge impact on blood pressure, but so does diet and exercise. And we can also use herbs that help to reduce blood pressure and control blood pressure. And potassium. Potassium alone is a blood pressure modulator. And if your blood pressure is kind of on the edge, that can be a great place and very safe place to start is oral potassium. Now, talking to your doctor about what are my risk factors, lisinopril helps with kidney function. It's nephroprotective. So if you have a lowering GFR, if there's concern about losing kidney function, then maybe that's the one to use. I tend to start with hydrochlorothiazide if I need to use which is I actually am forgetting the mechanism. Loop diuretic. It is a diuretic. Yeah, it's and so it's not a.
But lisinopril is
an ACE inhibitor.
Yeah.
Yeah.
But I mean, it's a very common medicine. I'm just bringing up this as a fact to show how difficult it is, because we try to help one thing, but obviously if your blood pressure is too high, you could wind up with a stroke or a heart attack. So that could supersede things until we get the blood pressure under control. But you mentioned herbs for blood pressure. Since you mentioned it, I got to ask you, what herbs are good for blood pressure?
So Rauwolfia is one that comes to mind immediately. And this is an Ayurvedic herb, but it is a low dose herb. So it can be toxic in too high of doses. And so you want to work with a well-trained provider if you're going to look at some of the alternatives for antihypertensives.
How about statins affecting your memory?
Yeah, so the issue is that, like you're describing, we're trying to thread this needle. We want to control the risk factors like high cholesterol and high blood pressure that might lead to vascular dementia, but we don't want to take on the side effects that are associated with the medications that do that pretty well. And so the best thing to do is diet and exercise and stress management. That is the best way to approach this. But that's not accessible for everyone. For some people, they just need that pill that's going to reduce their risk factors. And instead of using statins, we like to use cholestyramine, which is a binder that helps to bind bile. And then Zetia, it hasn't been around for too long. I've used it with patients for the past 18 months or so, or maybe 12 months or so. And what we've seen is that works effectively, especially for hyperabsorbers. And this is a way to get around the statin medications. But of course, high fiber diets also help to reduce the risk of high cholesterol. And then making sure we're focused on those good fats, avoiding the combination of high fat, high sugar diets.
And Valium and Xanax can also affect memory, is that correct?
Benzodiazepines and also antihistamines can basically alter the neurotransmitters in the brain that can impact cognition negatively.
So someone that's taking Benadryl every day, that certainly could affect things.
Yeah, we want to try to get away from that, use supplements and other natural sleep support, things like melatonin, magnesium, GABA, theanine, taurine. Those are the types of amino acids that can help us get better, higher quality sleep. Even inositol prevents the production of amyloid plaques and helps us to get to sleep. So there's lots of alternatives for sleep.
Dr. Heather Sandison, I want to thank you for joining me this week on Open Your Eyes with Dr. Kerry Gelb. I'm so excited that you're here. We're on AM 1280 The Patriot. And Dr. Sandison has been kind enough to join us again next week, where we're going to really dive deep on things you could do to reverse cognition, problems with cognition, dementia, and pick up her book, Reversing Alzheimer's. It's now a bestseller on the New York Times list. We'll see you next week.
Your eyes and your vision are under attack. Damaging blue light from the sun, your phone, your computer, your tablet, even light bulbs and car headlights is constantly bombarding you. The good news is our eyes actually already have a line of defense to counter the effects of blue light. This defense is made up of 3 pigments called carotenoids. MacuHealth with Micromicelle, the only supplement with the exclusive patent on all 3 macular carotenoids and Micromicelle technology.
Fitting multifocal contact lenses presents a big opportunity to meet patient needs while growing your practice. Alcon is your partner not only with our innovative portfolio, but through e-learning. Learn to enhance your multifocal strategy today with the Alcon Experience Academy.
OIE Broadcasting is the emerging leader in social media. We use scientific entertainment to drive more patients into your office. Visit oiebroadcasting.com and sign up today.